Welcome to The Healthy Advisor, a podcast from WealthManagement.com focused on advisors' personal well-being and healing. I'm Diana Britton, managing editor of WealthManagement.com, and in this podcast we explore some of the struggles and personal development issues facing advisors and financial services professionals, and how to get to a place of healing for mind, body, and spirit. Hello, and welcome to the latest episode of the Healthy Advisor podcast, and thanks for joining us. As you may know, this is the podcast focused on financial health and well-being, and today's guest definitely counts on that score. Her name is Martine Lellis, who she was recently promoted to Principal of M&A Partner Development at Mercer Advisors, a $60 billion RIA. Martine, thank you so much for being on the podcast.
I'm excited to be here. Thanks for having me.
So Martine and I are actually recording the podcast live from the Wealth Management Edge conference in sunny Hollywood, Florida. So we're face-to-face, which is not usual for my podcast, but always great being in person. Martine was just speaking on a panel talking about M&A in the RIA space. She's a frequent speaker at industry events, mentor to young financial services professionals, and a referee for Olympic weightlifting. And with this new role she's taking on, she'll soon be, the face of Mercer to potential partner firms that the firm may take on. So a lot of people know you, Martine, but less folks know your story from when you were younger. And so when Martine was 20 years old, she had a near-death experience. She had pneumonia, which escalated to acute respiratory distress syndrome. She was in a coma for 2 to 3 weeks and received her last rites, actually, which is the religious ceremony that's performed by a Catholic priest for someone who is dying. So, wow, Martine, take us back to that time in your life and what happened. Tell us what happened.
Yeah, that's right. It's interesting to talk about this because it happened so long ago. It's actually 26 years ago. I'm 46 now. And I was 20 years old. I was actually a student at Duke University. I had gotten quite sick and was just having trouble breathing and, just felt very ill. And I remember very distinctly having trouble just walking to the bathroom, to use the restroom, getting around the dorm area. But this all happened very quickly. And there was a distinct time when I remember going to the bathroom. I had to actually lie down on the floor. I couldn't breathe. I got back to my dorm and I knew something was very, very wrong. And I called one of my close friends. I still remember this friend, Lisa. And I told Lisa, I said, I think you need to call 911. I'm sick. And she did. And they took me out in an ambulance on a stretcher. And I went to the hospital. And the doctors did notice that there were issues with my oxygen levels. I was having severe trouble breathing. They did a chest x-ray. I believe at that point they did know that I had a double pneumonia in my lungs. So that meant there was pneumonia on both sides of my lungs. And my parents were contacted. My sister, I believe, maybe it was spring break, and I think she was actually in California. So my family was actually trying to get to me. But everything escalated quite rapidly, and I was losing consciousness because oxygen levels kept dropping, and they were turning the oxygen up to support me. So I don't have a lot of memory, but at some point I did lose consciousness even before my family was able to get there.
Oh, gosh.
So within 36 hours, I believe, was the kind of critical moment when it actually escalated to what's called ARDS, acute respiratory distress syndrome. And there's not a lot of known reasons why a person's body's immune system actually responds in a very aggressive way. But in essence, it sounds terrible, but your body sort of floods itself with fluid and you sort of start kind of drowning in your own bodily kind of fluids. It's very serious, and that was in the late 90s. It's a very deadly situation, and the doctors made sort of a critical life and death decision to induce a coma, which sort of shuts down all of your bodily functions, and it's a sort of last ditch effort to create a possible chance of survival. So they did put me into a coma. I was ventilated, and I believe my family got there at some point. I'm not sure exactly when, but that's what happened.
Yeah, and so what happened after that? Like that, where the doctors, you were able to survive. How did you come out of the coma?
Yeah, all of that, obviously I don't have a lot of memory, but I believe my parents were told that at one point that I wasn't going to survive. And that's why we were raised Catholic, and that was why someone was brought in to perform that last rites ritual. And I believe my family did say goodbye to me, but by some miraculous event, I managed to survive through that night. And then at that point, I think vital signs started to gradually improve. Of course, when you're in a coma, you have sort of, I think lower levels of vitals. They're sort of checking on basic brain function and other basic heart function and things that are still showing signs of life, and things were actually improving. And at that point, the doctors did say, like, I think she's going to, make it. But make it meant, possibly survive. It didn't necessarily mean awaking from the coma. It didn't necessarily mean having normal brain function or normal lung function at that point. So it was sort of a wait and see approach. And then at some point when they start to believe that things are improving, they decide to start to ease off of the medications that are keeping you in the coma. And then it's sort of a wait and see approach about whether you wake up from the coma. And that's when it was sort of a waiting pattern. And eventually I did wake up from the coma, and I do have a good memory of that and waking up and being heavily sedated and drugged, but I was on a ventilator, tied down to a bed. It's very kind of distressing to awake and not really understand quite what you've been through, but I did have quite a good knowledge that it was very serious, and you're obviously hooked up to a lot of machines and IVs and other things that are sort of still sustaining you. And you can't communicate. I think that's the hardest part, is that the only form of communication I recall was having a marker and a whiteboard to be able to, write notes to my family, but you're sort of not in a very good headspace to write very easily to them. So at that point, though, I was able to start processing some of what had occurred. And that was maybe after a couple weeks of being, in the coma. I'm not quite sure how long it was, but yeah.
How long did it take for you to kind of get back to normal functionality in life?
Oh, several weeks. I mean, I think the good news is you're young. So, and the doctors did say it was pretty miraculous, like how quickly after that I actually started to make progress. The process after that was actually quite rapid. Then we were sort of wondering if I was going to be able to move around without oxygen assistance. And miraculously, I was able to get off of the oxygen. My lungs actually returned to pretty normal function, although, they may always be slightly below normal. As I always joke, I will not be a professional athlete as a result of what occurred to me, but that's okay. I think I have to live with some things that may always affect me given what this trauma that I went through. But I was able to restore after a few weeks in the care unit to not have to rely on oxygen, and then was able to go home. And of course, I didn't really like being at home. I really, as a 20-year-old who was in school, I really wanted to get back to school.
Yeah.
And ultimately, getting back to school actually progressed my recovery. Just getting up and starting to move around normally and starting to be a normal, even though I was 20, but normal teenager again and normal college kid again, really actually made a pretty quick recovery. But it probably took, this all occurred in March of 1998, and I probably went back to school sometime towards the end of April. And then, school probably let out a few weeks after that. Yeah. And then in the summer, I did an internship in the Washington, D.C. area, and I was still recovering during that time. And I probably wasn't truly back to normal until I started my senior year of college.
Yeah. I mean, I know that you were telling me that experience changed your life and the way that you live it. How did it change you?
Yeah, I think there's a couple different ways that these things can kind of go. And in talking with the doctor and understanding his research and the way that this can affect patients and also affect the families, a lot of people can really regress and go through a lot of PTSD and a lot of severe trauma and can really have a lot of struggle. I think the good news for me is I actually kind of went in the opposite direction. It gave me great resolve and gratitude for wanting to live a really vibrant life. Mm-hmm. And I really had keen awareness that my time on this earth was not done. And it was not time for me to be done. And I was given a huge opportunity to do something in this world. And waking up every day and recognizing that my life had almost ended and really could have ended, I started to live life with, I think, an extra amount of spirit in me, and said sort of, what can I go do in this world? And that gave me this sort of passion and compassion to go out and try to do everything that I could to live the best life, and for myself and also for others. So it sort of put that extra pep in my step, so to say, to take advantage of everything that was around me. I kind of got to work in a sense. I've always been very goal-oriented. I think I was kind of born goal-oriented, but I sort of set a lot of different goals for myself and went to take advantage of that from there forward. And it's made me very grateful to have every single day that I'm given and to not kind of squander the opportunities that have been set forward.
Yeah, well, I think just for me personally, you've been like a little bit of a role model, although I'm not, an advisor, but, to see a woman, at a young age be a C-suite executive at, a major RIA, and to be in the room with, all these bald, men and like older men and be able to really be eloquent and hold your own. And so I don't know, it's great. We love you. And, I'm so glad that you're here, that you're okay. And I know that you were telling me you met the doctor who saved your life recently. And tell me about that experience. What did he say? What did you say?
Yeah, that was incredibly special. I mean, how many people get an opportunity to go back 26 years later and give gratitude to the person who saved their life? That wasn't just him. Obviously, there was a huge team of doctors, nurses, caregivers that all came together to help this 20-year-old that was really absolutely just helpless, in a coma, can't breathe, literally dying, and all came together and made very critical decisions, probably in the moment, and cared enough to go the extra mile to save me.
Yeah.
But I remembered his name, and his name is Dr. Gobert. He's a pulmonologist at Duke Hospital. And I kind of followed him a tiny bit, like just understood where he was. He's still practicing care at Duke. And I have been working with a gift officer at Duke to do some charitable work now. And it was an opportunity for me to inquire if I could meet him. And they were able to set up that meeting. And it was a really special meeting. I think that he actually had good memory of the time that we spent together in his care unit and under his care. There's not many students that actually go through that type of experience. And so he had memory of a few students that actually had gone through that care unit during the time that he was in charge of that unit. And he was pretty young. So, he's still practicing medicine, and we were just able to talk about, what I went through, and he was very grateful to see what I had done, over these past 26 years. And he asked me a lot of questions about, potentially what I had gone through trauma-wise maybe afterwards, because he has done a lot of research on ARDS and the effects of trauma of survivors of ARDS, and also the effects of how it has affected families. And so we had a really great conversation. And what I really wanted to ask him is there anything that I can help him with in terms of causes that are maybe near and dear to his heart, because I really do feel like I'm at that phase in my life where I want to show gratitude and give back. And so we had a really warm conversation about that. So that was really special.
Yeah. And so just tell me, like, real quickly, like what is the charitable work that you're working on now? You're trying to set up a financial literacy fund, I think, for...
No, so I've done a endowment at Duke to give to students that have financial need. So that will provide scholarship, because I wasn't able to go to college without receiving scholarship and financial aid, because my family couldn't afford the cost of education, and so I had to work a lot, and I also had to apply for financial aid. And if it hadn't been for generous donors that were giving during my time there, I would literally not have been able to afford to go to school. So I've established an endowment that will provide a scholarship each and every year forever in perpetuity to a need-based student. So someone who cannot afford to go to school, and that will be granted every year. So that's one thing that I've done. But what I'm exploring with the doctor is something that will likely provide for help with clinical care. So really, how does a doctor-patient relationship kind of work in the sort of like clinical side of things? So the aftercare effects of when someone goes through different types of trauma. So that seemed like a cause that was really important to him, and we have to work out the details of that. But I think that's also, I remember how caring he was after my stay in the hospital. And, it sounds like that resonates well with him and would be something that would be really good to get back to. So I'm excited to pursue that as well.
Yeah, that's awesome. And so I know I wanted to talk a little bit about COVID. I know that you got COVID, and, obviously we know that with folks with, respiratory disorders, it takes on it can be very serious, and it was very serious for you. Yeah. Tell me what happened.
Yeah, so I did suffer from some serious blood clotting after COVID, and I also suffered from long COVID as well. And it's likely that because I had some immune response from this double pneumonia, that it's likely that my body just is triggered with certain immune responses in other things. And so perhaps there is some correlation, perhaps there's not. We just don't know. But I do have to be careful with any respiratory situation because of the risk of potentially my lungs just deciding that they don't want to respond in any way. So with COVID, I had a double pulmonary embolism and double deep vein thrombosis, which means I had blood clots in both lungs and both legs. So it was a very serious situation after that. So and then suffered, extensive long COVID symptoms, which required therapies to deal with the brain fog and to deal with occupational therapy to actually get back to exercising and doing other things. So I'm very, I'm grateful that I had care that helped me, through that as well. But it's hard to know if there's any linkage between those two events, but there could be, and certainly grateful that I have access to care that can help.
Yeah. Was it, were you seeing a therapist for your mental health as well during that time? Or
I started seeing one during that time. Yeah. Because I think dealing with a recurrence of a medical issue that causes just, I was dealing with excessive fatigue. I was, struggling with rehabilitating from the blood clots, which bring up a fear that you could die from blood clots. They're a very serious condition. So I think dealing with all of that, I did, start seeing a therapist during that time, just because it was a long haul to recovery. So it was very helpful to seek that kind of help.
Yeah. I mean, so I'm guessing I wanted to talk a little bit about how these experiences have shaped who you are today, the work you're doing at Mercer.
Yeah. Yeah. I think I live with this sort of attitude now of like, what do I have to lose? I mean, I've already been through an experience or two or so that where I could have lost everything. And I think that when I wake up in the morning and I think what do I have to lose, or what could be the biggest risk that I could take? Most of the time I look at that and think not much. So that makes me a pretty, I think, bold person in my choices and sort of assertive in the way that I sort of view walking through this life. So when it comes to making decisions, when it comes to asking for things, when it comes to asserting myself in this male-dominated industry, as you kind of indicated, I think that's made me be a good advocate for the things that I want to see, or the changes that I want to ask for, or for other women, or for whatever I'm trying to help build. I think I'm not afraid. And I think you can choose to walk through life in fear, or you can choose to walk through life being more timid. But if you choose to say, what do you have to lose? And you really think through that sort of ability to not be so fearful, then it does make you have a lot more sort of power to advocate for change. And so I have been, I think, a change agent in working as a chief operating officer and now chief talent officer, and in this new role advocating for finding the right partner firms for joining Mercer. I like to think about being progressive in this, I think, wonderful industry that we're in, where we can help so many clients, but we can also help so many employees. And I've really been on the business siding build of the business.
Yeah.
And that's a passion of mine, is thinking about how much we can do inside this business. It's so good and great for providing. We talk about economic freedom for our clients, but at Mercer, but I also think about economic freedom for every employee that I'm helping provide a job for. So if I'm helping contribute to the growth of the organization, I'm helping to provide jobs for so many different people, then I just think about how many people can flourish because of all the different growth in the business. That makes me really not timid about or shy about just being bold in the messages that I'm bringing and what I'm asking for in terms of trying to accomplish various things. So I encourage people to think that. And I think just being an optimist too is incredibly important. You can choose to walk through life and view things as obstacles, or you can choose to view things as opportunities. And when you have that lens and you see something that's maybe in your way as an opportunity of learning from it, of conquering it, of asking people to help you work through it, then I think that's just such a more powerful way to walk through life than of seeing something as an obstacle. And I could have chosen to see my, near-death experience as something that was an obstacle or something that harmed me.
Yeah, absolutely.
But I really chose to look at it as an opportunity to go live this second chance on life that I had as an opportunity to live a life in gratitude and abundance.
Yeah. Wow. I'm getting chills just hearing you talk. I mean, it's really great to hear your story, because it kind of makes a lot more sense why you are the way you are. And, it's been great to just get to know you better. So thank you so much for sharing your story. Well, I think we're just about out of time, but I'd like to thank my guest, Martine Lellis, for being on the podcast and being so vulnerable. Martine, I know it's not easy to dredge up these things from the past, and so thank you for opening up.
Yeah, well, the more we share, the more authentic we are, the more vulnerable we are. I think the more it allows others to be that same way, and we all learn from each other in that experience. So thank you for having me here.
Yeah, I know I've learned a lot just by hearing you talk today. And if you'd like to reach out to Martine, you can find her on LinkedIn, right? Reach out to Martine on LinkedIn. If you yourself have a struggle, you wish to share your experiences and help others in similar situations, please feel free to reach out to me at diana.britton@informa.com. I'd like to thank you for listening to The Healthy Advisor. If you've not subscribed to the podcast yet, please click the subscribe now button below. This is Diana Britton reminding you that where there's healing, there is hope. We'll see you next time. Thank you for listening to The Healthy Advisor, a podcast focused on advisors' personal well-being and healing. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of WealthManagement.com. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional advice. Always seek the advice of your healthcare provider with any questions you may have regarding your particular situation.